We ready? Yeah. I'd asked Major Jason Vecca to lead us in the Pledge of Allegiance this morning.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Welcome to the March 11th, 2019 meeting of the Shawnee County Board of Commissioners. My name is Bob Archer. I currently serve as chair of the commission and represent District 3 alongside Commissioner Kevin Cook, who represents District 2. Commissioner Rippon had to go to Washington State for a very important event with his son. And I would have canceled the meeting today, but we don't have a meeting Thursday, so it gets complicated. So I will try to remember to say motion passes 2-0. First item of business, please.
First item is item 3, consent agenda.
I'll move for approval.
Motion made to approve the consent agenda by Commissioner Cook, seconded by Commissioner Archer. All in favor say aye. Opposed say no. Motion carries 2-0. Next item, please.
Item 4, new business A, County Clerk number 1, consider all voucher payments.
We have vouchers that total $1,178,333.80. The highlights of the voucher report are really in 3 areas. The first is in payroll, that being $551,191.68. The second is in health insurance administration for employees, and that is $302,927.11. And then finally, in the area of parks and recreation, we have $104,790.19. Having reviewed the vouchers, I don't have any issues, and I would move for their approval.
Motion made to approve the vouchers by Commissioner Cook, seconded by Commissioner Archer. All in favor say aye. Opposed, no. Motion carries 2-0. Next item, please.
Item A2, consider correction orders.
I'll move to approve.
Second.
Motion made to approve the correction orders by Commissioner Archer, seconded by Commissioner Cook. All in favor say aye. Opposed, no. Motion carries 3-0. Next item, please.
Item B, human resources. Number 1, consider approval of request to fill a human resource specialist 1 position at a salary including benefits of $45,339.33. and fill any positions that would become vacant as a result of filling this one.
Good morning, Commissioners. Angela Lewis with Human Resources. We'd like permission to go ahead and fill this HR Specialist 1 position as soon as possible. Renee Aldridge, the person who currently fills the position, is going to work for emergency management at the state, and we're very happy for her.
Okay. I don't have any questions. I'd move for approval.
Good. Motion made to approve the request by Commissioner Cook, seconded by Commissioner Archer. All in favor say aye. Opposed, no. Motion carries 2-0. Good deal. Thank you, Angela. Next item, please.
Item C, Health Department number 1, consider approval of request to apply for the Kansas Department of Health and Environment's aid to local grants to include state formula, childcare licensing, chronic disease risk reduction, maternal and child health, immunizations, family planning, and public health emergency preparedness, local, regional, for the state fiscal year 2020 for an amount of $1,203,507.
Good morning, Commissioners. Linda Oaks from the Health Department. This is our annual Aid to Local grant from Kansas Department of Health and Environment. It's really a menu of multiple grants, so I'm going to do a quick run through of each program. I have all the division managers here. We're kind of like Parks and Rec today. We've brought a lot of people to help answer questions. So if you have any questions about the individual programs as I go through, please feel free to stop me so you don't have to remember to the end. So this year we are requesting $1,203,507. Last year we requested almost $1 million and we were awarded just about $900,000. So I'll go through each program, and then, as I said, if you have questions, please feel free to ask me. I do want to mention that Nancy Mitchell is our accountant who put all the budgets together, so if you have budget questions, she's our gal. Edith Gaines is our administrator over this. This is kind of a new computer system we had to apply through. So I can tell you that everyone has put many, many hours into this work. And so either one of them can answer questions, but Nancy is your gal if you have the budget questions. And she does a great job of sitting with us and explaining math to each of us. So I really appreciate it. So Childcare Licensing is the first program. This is the program that regulates all child care centers, homes, preschools, daycares, after-school programs. So right now we have about 375 licensed providers in Shawnee County. Last year when we applied, we had 403. So I think I've mentioned before, I'm getting a little concerned about the drop in child care. And so we're doing some work with Child Care Aware of Northeast Kansas to help promote child care as a possible career for people. We had one big orientation that was free. We're going to do that again. We're just trying to reach out to people who might be interested in becoming child care providers. I think this is an economic issue. It's pretty hard to go to work if you don't have legal and good child care. So we'll be working in this area some more this year. And you look like you might have a question, Commissioner.
Well, I'm just wondering why we've had the drop. Would you say 403 to 375? Do you have any ideas on why that's dropping?
Well, I think there's several things happening, and it's happening nationally as well as locally. A lot of child care providers are aging out. I mean, they're retiring. And so we see a lot of home providers retire. There's really no one to take their place. There's a lot more pre-K programs now, so that takes children away from the child care centers into those pre-K centers. So I think there's a combination of things that are happening that are, and there's a lot of job openings here in Shawnee County.
Yeah,
this is an area that there are also job openings. So it doesn't pay real great, so we need to be working on some of those issues. So, yes, Commissioner Cook?
I might just note that the state has more regulations that KDHE has imposed upon daycares. The daycare costs to comply with all the regulations from the state. That's a cost that's then shifted to the parents. The daycare centers have to trade off increasing daycare rates, which means a lot of parents are going to unlicensed child care, which is again the concern from a county position, is we have children going to unlicensed child care centers.
And of course, when that happens, we worry about the safety of the children at that point.
Yeah,
So,
excellent point.
okay. Carrie Dels is the division manager over this program, and it's part of the environmental health program. So we're requesting $163,920, and that's all salaries for our staff. The next program is the Chronic Disease Risk Reduction Program, and this is the program where we address those chronic diseases that impact the health of our community. So we talk about tobacco use, physical activity, and nutrition. We're requesting $86,354 this year. Craig Barnes is the division manager over this area. In this grant, we have requested another position, a health promotion specialist. We are really busy in this program, which is great, so we need some more help. So we'll see if we get that funding. So chronic diseases account for about 75% of healthcare costs a year. So this is a very important area. So we'll be looking at Tobacco 21 in other communities in our county, smoke-free multi-housing, pregnant and postpartum smoking cessation, and the Farm and Food Policy Task Force, which you'll be hearing more about as the year goes on. The next is the Immunization Action Program. This is the Vaccine for Children program. We receive free vaccine for children who are on Medicaid, uninsured, and in the Children's Health Insurance Program. Last year, we gave almost 7,000 doses to about 2,184 eligible children. And we do get this set allocation. It's $36,547. The state sets that amount, and it's based on our number of children in poverty. So this is a very important program, and that all this money, except a little bit of it, goes into salaries for our staff.
There's been some controversy about vaccines. Would you want to comment on that?
Oh, I'd love to comment on that. Yes, there's always controversy about vaccine. You've probably heard about the measles outbreak, yes, especially in the Northwest. We're very concerned about those kind of outbreaks for multiple reasons. Measles is not a benign childhood disease. It can kill children. It can make children sick and disabled for their life. It's a serious disease. And measles is one of those funny diseases, I guess funny. You have to have 95% vaccine coverage in order to get herd immunity. So in order for everyone to be protected that can't be vaccinated because they have medical reasons, Some of the reason they can't vaccinate, we have to have a 95% coverage rate. And they've seen a lot lower rates in those areas in the Northeast and in some parts of New York. I think they've had some cases also. So that is our biggest concern, is that once you start getting measles around, it's very contagious. It's in a room 2 hours after the person leaves and exposes everyone. Yeah, it's very hard to investigate. I heard on NPR that Minnesota last year spent $1 million on a measles outbreak investigation. And that can happen quickly. So we really want to make sure that everyone gets vaccinated appropriately for their safety, for the safety of people who can't be vaccinated, and for the cost. So vaccines work. They're effective and they're safe. They're one of the great public health achievements we've had in our lifetime, and they're just a great thing. And so we really want to encourage everyone to get vaccinated. Vaccines are available, most doctors' offices, lots of pharmacies, the health department, they're everywhere. Cost is no barrier. We'd never refuse for people who can't afford to pay. The vaccine is free for the Vaccine for Children program, so there's really no reason. We'll get you vaccinated if you want to get it. So I hope we don't have to ever come to you and say we have measles outbreak in Shawnee County, because it's a serious one.
Well said. Thank you.
Thank you. Next is maternal and child health. This, we are requesting $441,762. One of the reasons this has gone up some this year is that we're requesting a second registered nurse for this program. We're doing First Steps, which is a social work visitation program, Baby Basics, which is our class, newborn home visits, and the fetal infant mortality review program. The Baby Basics class has been very popular, and we're seeing quite a few people in that class, and so we want to be able to expand that class, take it to other areas of town. It is for pregnant parents, pregnant women and their partners. Teresa Fisher is the division manager over that area. Fetal infant mortality review is looking at our infant deaths and looking at trends. You're going to see some more information. We're taking a deep dive into that. The state just came out with their report, and our epidemiologist is working on a deep dive into those rates for Shawnee County. So you'll be getting some more information about that as the year goes on. Local Preparedness is the next program, and this is the program that we're requesting $122,113. Craig Barnes is the division manager over this program. This program is dedicated to ensuring that our community is prepared on a community level for public health emergencies, and that we help Shawnee County residents prepare on an individual level. We also have the Medical Reserve Corps program, which is our volunteer program under this area. You might see those folks. Sometimes when we have flu clinics, they help with shots. They help with some of the other activities. We do some exercises to be prepared. This amount pays 100% for one of our emergency preparedness specialists and 60% for the other, so it's all salary. And then regional preparedness. We are the fiscal agent for the region for emergency preparedness. It includes Atchison, Brown, Donovan, Jackson, Jefferson, Marshall, Nemaha, and Shawnee counties. So we oversee the grant, we oversee exercises and training. The requested amount is $34,221, and that pays for 40% of that other EPCO specialist. So again, all salaries and some equipment and supplies and training. We work very closely with our Shawnee County Emergency Management in these programs, especially the local program too. State formula is a grant that's based on our population and our tax allocation. So what you allocate to us, they base our amount on. And so this year they're allocating $120,472, and that funds 80% of 2 of the nurses in the communicable disease program. We can use that money for whatever we want, and that's what we choose to do with it. So here is our newest program that we're requesting, family planning. We have had requests from the Kansas Department of Health and Environment, as well as many community members, to provide family planning once again at the health department. We did years ago, we stopped, and now we would like to bring it back to fill some gaps in needs in our community. So we're requesting $198,118 to start the program. It would not start until probably the end of this year or the beginning of next year. We think there's a need, that we've had enough requests, and that we also think this is another avenue to address our sexually transmitted infection rate, which when the county health rankings come out next week, you're going to be hearing about that again. I have a feeling it's going to come up. So we did a survey of our STD clients and our WIC clients in December. So we we surveyed 315 people, and of that group, 53% responded that they would strongly agree or agree to come to the Shawnee County Health Department for birth control. So I think that's a pretty good statement from that group of people that, yes, they would use the health department for these services. So we are hopeful that they will fund us for this, and you'll be hearing more about that as the year goes on. So this is a comparison of last year's awards. That's in the blue, and the red is our request, and you can see the areas that went up where we requested more staff, MCH, CDRR, and of course family planning, which is new. So, and Carrie Delfs will be overseeing family planning. So she has environmental health, the clinic, WIC, and family planning, so we're keeping her really busy. So at this point, that is all the grants that we're requesting to apply for today, and we'd be happy to answer any questions that you might have.
Commissioner Cook?
I don't have any. Very comprehensive. Thank you, Linda.
Sure.
Yeah, it was a very good presentation. I'd like to publicly thank you and note the tremendous progress that we've made in the health department under your leadership.
Thank you.
I'll move to approve the request.
Second.
Motion made to approve by Commissioner Archer, seconded by Commissioner Cook. All in favor say aye, opposed no. Motion carries 2-0. Next item, please.
Item D, Emergency Management. Number 1, consider approval of request to purchase radios and accessory equipment from TBS Electronics, Inc. under the State of Kansas contract at a total cost of $37,596.65 with funding from capital outlay.
Good morning, Commissioners. Nelson Castile, Emergency Management. This is part of our radio sustainment we had put in for and was approved in December for the capital improvement for 2019. I'll stand for any questions you might have.
I don't have any. I'll move for approval.
Motion made to approve by Commissioner Cook, seconded by Commissioner Archer. All in favor say aye, opposed no. Motion carries 2-0. Thank you, Nelson. Next item, please.
Item F, Facilities Maintenance. Number 1, consider approval of request to transfer $75,000 from the 2019 Contingency Fund to the Manor Conference Center Deferred Maintenance Fund to finance repairs and services at Manor Conference Center in 2019.
Good morning, Commissioners. Bill Crow, Facilities Maintenance Director. This item is dealing with the Manor Conference Center. About a year ago, there was some money moved to do some renovations at Manor. I believe the total amount that we put into that fund was just short of $300,000. The renovations for the new carpet, the painting that we completed at Manor have thus far come to just shy of that number, about $280,000 at this point. And with some of the expenses that we have going forward into 2019, I think we're not going to have any funding to deal with issues that come up at Manor. The most pressing issues right at the present time are, I got a call Friday regarding the ADA doors as you come into Manor that they've malfunctioned or are no longer operational. And we just don't have the funding to keep putting into Manor at this point because we had some expenses that went a little higher than we had anticipated last year in the form of the, after we removed the wall covering, the wall damage was more extensive and ran into some areas where the old vinyl asbestos tile, when it came up, caused us some additional expense in carpet installation. Be happy to answer any other questions that you might have. I think this amount will get us through Manor for this year, and I know in the future, Finance and the Counselor's Office is looking at other ways to finance Manor issues as they come in the future.
Very good questions.
Well, Bill, I know that you and I have talked about that the doors at Manor are needing the electronic magnet release
Yes.
in the event of a fire, and those were $1,500 per door.
Right, about $1,500 apiece.
And then the ADA door went out.
It went out on Friday.
And now we also have the issue with the a pump station that's at Manor Conference Center. That we don't
It
know how much it's
actually
gonna cost.
is in the extension office part of Manor Conference Center, but all the Manor sewage lines do go through that pump station. And as we got into Manor last year, we found all kind of different things. Our electrician has been very busy out there. Fortunately, we're doing most of that, 99% of that work in-house. So getting things fixed up and trying to keep that place nice for the future.
So this all falls under deferred maintenance that we just didn't realize how extensive it really was?
That's correct.
And then the request is $75,000, but you don't know exactly how much the pump station might even be.
No, at this point, do not. That will get us started, to at least take a look at the thing and see if we need to do any replacement. It's operational, but when you see something that rusty and you start taking it apart, you always are nervous because you could start taking it apart and then make it break. So we want to be very careful as we move forward with that.
Just, I guess my concern is we just don't know exactly where our deferred maintenance.
Where it'll end, yeah.
Okay.
That's true.
Yeah.
All right.
It's been nothing but landmines.
Out there, pretty much, that's what it's been.
Yeah.
From the cosmetic viewpoint right now, it's fixed up, looks nice, and we're in really good shape out there now with the paint job and the new carpet. I feel a lot better about the electrical system right now than I did 6 months ago. But Evan still has a lot of work that he'd like to get completed out there to make sure that it's 100% safe.
Okay. I guess I'll move to approve the request.
Second.
Motion made to approve by Commissioner Archer, seconded by Commissioner Cook. All in favor say aye. Opposed, no. Motion carries 2-0.
Thank you.
Thank you, Bill. Next item, please.
Item F, Administrative Services. Number 1, consider authorization and execution of contract C-124-2019 with Smith Detection for annual maintenance of the courthouse metal detection equipment at a total cost of $9,758 with funding from general expense.
Good morning, Commissioners. Jennifer Sauer, Audit Finance. I'm just bringing to you today a renewal of our service agreement with Smith's Detection, which handles the metal detectors here in the courthouse. This is has been reviewed and approved by the County Counselor's Office, and the amount is the exact same as it was last year, so we're here seeking your approval.
Questions?
Nope. I'll move for approval.
Motion made to approve the contract by Commissioner Cook, seconded by Commissioner Archer. All in favor say aye. Opposed, no. Motion carries 2-0.
Thank you.
Jennifer. Next item, please.
Item G, Public Works Solid Waste. Number 1, considered authorization and execution of contract C-125-2019 with MCOM, Inc. for the replacement of the failed Sherwood wastewater system pumping station at a cost not to exceed $375,415.68 with funding from the Sherwood Regional Wastewater District.
Good morning, Commissioners. Kurt Neaus, Director of Public Works and Solid Waste. INCON has been our on-call emergency contractor since 2015. Pump Station 60, we were approved to consider that an emergency project via Audit Finance in late September of 2018. So this contract just formalizes the work on this project, Pump Station 60, again with IMCON, who we've been working with. What's nice about working with this on-call contractor, which I'll discuss the project in a little bit, is we've been able to work with the contractor from the very beginning of design. Much of the equipment has already been ordered, so in 2 weeks we can start work and we should be able to work uninterrupted. We don't have to wait for equipment or anything like that. So now let me briefly talk about this project. On the picture before us, up is to the south, and so along the south side of the picture we have 37th Street, and just at the east side, or on the right side of the picture, we have Wood Glen Street. And right kind of in the center of the picture, you see a square with a circle in it. That's the present pump station. Let me bring this up. This is what the pump station looks like. It's probably in a 90% failure mode and needs to be replaced. That's what we're working on. Plans have been completed. Again, the work will start in 2 weeks from today. And when the project's complete, it'll look something like this, which I think will be much improved for the area. Everything will be nearly flush with the ground. The existing pump station will turn into a manhole. We'll sink a new wet well adjacent to the existing wet well. They'll look something like this. They'll have lids where you can gain access, and then you'll have a control panel. The control panel will be really the only thing that you can see from the street. The control panel will be placed approximately in this area right here, so that during the summer months when the vegetation is in full bloom, these people right here, these lovely people that have been working with us, won't be able to see the cabinet. The new pump station will be centered right about where the cursor is, and there should be absolutely no impact to the traveling public, maybe for very short periods of time while the contractor is unloading equipment. But there should be no long-term impacts to traffic on 37th Street. So with that, I'd be glad to take your questions. This money will come out of the Sherwood Fund 2690, paid for by user fees.
$375,000 seems like a lot of money.
It is a lot of money, but I want you to bear in mind that this wet well is 24 feet deep.
Wow.
And it takes some time to bury the shaft, and that's a maximum not to exceed. We hope that it won't come to that amount. That amount does include, just to put it in perspective, just does include a 10% contingency of approximately $35,000.
How many pump stations are there in the Sherwood Regional Wastewater Division?
There are probably north of 20, and they are all our responsibility to maintain. In the last 5 years, we've replaced, I think this is the 4th or 5th that we've replaced, and I anticipate going forward that this will be something that we'll have to address from time to time.
Okay.
The system is getting older in age. We have limited funds, but as funds become available, we will be looking at being proactive on the replacement of these pump stations.
Okay, very good, very good, thank you. Commissioner?
How is this our responsibility as Shawnee County Commissioners?
Well, that's a long story, evidently going back to the beginning when this system was put in. It was our responsibility. It was out in the county, and I guess Jim's coming up here. Is he wanting to make some more comments, or go?
Yeah.
Don't mean to interrupt.
Yeah.
Jim Krause, Shawnee County Councilor. This is the responsibility of the residents within that sewer district, but so it's paid for by user fees on the users of the system. By statute, by state statute, the Board of County Commissioners is the governing board for the sewer district. So we approve it through our county agendas. It's not general fund financed. It's financed by the user fees in the district that's served by these facilities.
Right.
So if we have pump stations that exceed what our user fees are, we would raise the user fees for the residents of Sherwood?
You either have to raise the user's fees, you have to go to the state and get a loan, which then we'll be paying back through, yeah, I mean, one way or the other, the users of the district will ultimately be responsible for the costs of the system.
So a person who is residing in Tecumseh or Dover or Silver Lake, they shouldn't have any concerns about that being them paying the cost of the Sherwood area?
Correct.
Okay. Just want to make sure that we're clear that this is really paid for by the people that live in Sherwood.
Yes.
Okay.
Right. 2690 fund, it's all user fees. So yes, no one outside of the Sherwood wastewater treatment district would pay for this repair.
And are we sending out notices to the people that live in Sherwood that they have an aging system and they might need to start thinking about what their fees are and that there might be raises to their fees?
We haven't done that yet, and the reason for that is right now we're in a 5-year increase in fees. And at this point, I think we're going to live with the increases from those 5 years. We're going to go forward a few years, and then at some point, I believe we will have to consider that and bring that to the people.
I just think, no one wants to get surprised.
Yeah.
One more time, I regularly attend the Sherwood Improvement District meetings. They're once a month, and this topic has come up several times. Tom Vlock has been to those meetings to discuss this. I know within the last 6 months, I've discussed it with the board the fact that all of the systems will be evaluated, and there will be issues coming forward. And so the board members are aware of it. Residents who attend meetings and follow minutes will see those items mentioned from time to time. So we do what we can.
I just know that this can come back as people being upset with the county commission when we would maybe have to raise the rates, and it's really something that should be discussed by their wastewater board, or something they should be talking to their citizens about, so that we're not being made out to be the bad guys. Wouldn't you agree, Commissioner?
I agree wholly, and if there's any way we can provide broader communication, because we don't know if it ever, if it gets out to the community as a whole, that we start that now, because Commissioner Cook is exactly right. Nobody likes to be surprised with big increases, and we've got an aging system that needs to be addressed. And if we've got 20 of these, and they're at $375,000 a pop, that's a lot of money.
Now, just to clarify, not all 20 of those are aged, some of them.
I know you said we'd replace 4 or 5, I understand
yeah.
that, but still, when we get
Yes.
replaced others, then the cycle will start all over again.
Right, absolutely.
So,
Now, I do want to add that we've recently met with the city of Topeka staff, and we're working on gathering information from the city of Topeka staff. Obviously, they maintain this system. When I say maintain, they're the ones that do the inspections, they do the minor repairs. Again, Shawnee County pays for that, but they provide the technical expertise on a day-to-day basis. We're working with the city to get kind of an idea of the condition of the system, so that going forward, we can create kind of an asset management plan like we do with our roads and our bridges, et cetera, et cetera.
Well, when you say we pay for, it's a pass-through.
Yes, because again, it's user fee funded.
Yeah,
Yes.
from the users.
Yeah.
It's a,
Right.
Shawnee County's a pass-through. Yeah.
I might just ask you also to reach out to the Board of Realtors and some of our different people that are out in the community. If somebody's buying a house, this might be their first house. And again, you don't want to have something that they could be aware of as they're buying the house, knowing that there could be changes or raises in their wastewater fees or in their fees that they pay on a monthly basis. And so that may be a big deal for somebody a year or two down the road.
Good point.
Yeah, you're exactly right. I think the more information that we get to more people, it's good, because we've got to provide strong wastewaters. I mean, it's a health issue more than anything else.
Absolutely.
We've got to do it, and we've got to do it right. So, any other thoughts?
I'll make a motion to approve the contract.
Motion made to approve the contract by Commissioner Cook, seconded by Commissioner Archer. All in favor say aye. Opposed say no. Motion carries 2-0, and this is good discussion, and it's just beginning. So, thank you. Next item, please.
Item H, Court Administration, number 1, consider authorization and execution of contract C-126-2019 with KBS Contractors, Inc. for renovations in courtrooms 300 and 311.
Good morning, Commissioners. LeDon Welch, Court Administrator, 3rd Judicial District. The contract before you has been approved by Jonathan Brazana, the County Counselor's Office, as to form. It is a standard 2-part contract with KBS Contractors, who is scheduled to begin work shortly. The timeline for this project is approximately 70 days. The amendment that's attached to the contract does set forth the guaranteed maximum price, which is actually almost $10,000 less than the original bid. I'd be happy to stand for questions.
No, I don't have any questions. We had to approve this as part of our capital outlay.
Correct.
And and the contract's here, so it's time to get started. So I'll make a motion to approve.
Motion made to approve the contract by Commissioner Cook, seconded by Commissioner Archer. All in favor say aye. Opposed, no. Motion carries 2-0.
Thank you.
Next item, please.
Item I, Employee Wellness Committee, number 1, quarterly report from the Employee Wellness Committee.
Good morning, Commissioners. My name is Amanda Monholland, and I am the Health Promotion Coordinator at Shawnee County Health Department. I am also a member of the Shawnee County Health and Wellness Committee for the county, and I'm also the chair for the Shawnee County Health Department Wellness Committee. So today I'm going to be giving you a brief overview of what we've been doing at both wellness committees at the county level and at the health department. The Shawnee County Health and Wellness Committee consists of 8 members and 1 chair. With the last 2 quarters, the committee has designed a logo, which you can see here on the right, and we've implemented a mission and vision statement, created a website landing page, and promoted several events. In November, we hosted at the health department a lunch and learn for tobacco cessation for all Shawnee County employees. We had 3 speakers come and discuss information in the areas of their expertise. Jordan Freeburn, who is the Kansas Government Relations Director for American Cancer Society, discussed how policy change matters and for cancer issues and other health priorities. Craig Barnes, Health Outreach and Planning Division Manager with Shawnee County Health Department, he discussed the Kansas Tobacco Quit Line, and a representative from the Blue Cross and Blue Shield. I'm going to go to our website landing page. Maybe. So I can give it a little bit bigger for you. There we go. So as you can see here on the left, there is the Lunch and Learn, which if you click on it, it'll take you directly to a link so you can actually watch it from the event. And then next is the city, okay, so the City of Topeka Fitness Center, Shawnee County and the City of Topeka partnered together to give county employees the opportunity to utilize the city gym. And then we've also have the Blue 365, which accesses our county's health insurance website for health and wellness. And what it is, it gives them deals such as like fitness, personal care, healthy eating, financial health, and lifestyle and wellness deals. The next one is the telemedicine, which is our First Stop Health. It is our county's 24/7 phone and video US-based physician portal. So some of the reasons why you might utilize this is sore throat, cough, sinus infection, eye infection, earache, upset stomach, medication refills, muscle and joint pain. And then we also have, last on the website here is the Live Well newsletter. So this is sent out monthly, and we also send out the Wellness magazine to all of our sites. Go back to so some upcoming events that we have going on at the county level for the Wellness Committee is the City of Topeka and Shawnee County will bring back the mobile mammogram on March 12th. Walk Kansas begins March 17th through May 11th this year. And Walk Kansas is a team-based program that gives chance to walk away stress, learn and make better nutrition choices, and help you get motivated to be more active with friends and family. Lastly, we have coming up is the Rethink Obesity Lunch and Learn, which is March 14th. This will be hosted at the Health Department again, and we will be videotaped, so it'll go on the website link. So this is a lunch and learn from 12 to 1. It's for all Shawnee County employees. Renee Lind, who is an obesity and diabetes educator at Novo Nordisk, which is the global healthcare company, she'll be presenting about the science of obesity and why the weight you lose and it doesn't stay off. Now moving into our Health Department Wellness Committee. The Shawnee County Wellness Committee at the Health Department consists of 7 members from different divisions, WIC, Community Outreach, Maternal Child Health, communicable diseases, and maintenance. Our two goals for the health department employees are to have access to programs to help them make better lifestyle choices and have the opportunity to practice healthy lifestyle behaviors. And so one way we are achieving these goals is by providing monthly challenges. Starting in November of 2018, we had our first monthly challenge for all Shawnee County Health Department employees. This allowed them the opportunity to practice healthy lifestyle behaviors, which turned into create healthy habits. So in November, our first challenge was the 3 Good Things Challenge, where employees wrote down 3 good things every day for 21 days. In December, we had the Chug-a-Jug Challenge, which was designed to encourage employees to drink at least 64 ounces of water a day. And then in January, we had the Let's Move at Work Challenge. We encouraged employees to get up and move for 3 minutes every hour at work. In February, we just recently finished, which was one of our most higher participating challenges we had for the employees, was the Path to Mental Wellbeing Challenge. Through this challenge, we wanted to help employees find ways to manage stress by completing the challenge with at least one stress relief activity every day for 19 days. What's coming up in April and May? In April, the Employee Health and Wellness Committee will evaluate our set objectives and feedback surveys from each challenge to decide how we will proceed our initiatives in June. In May, we will implement the next phase of our goals and objectives according to our evaluation in April. May is also Employee Health and Fitness Month. We will have our annual employee recess during our all-staff meeting. So, do you guys have any questions?
No.
Question?
Very good. Thank you, Amanda.
Thank you very much. Next item, please.
Item 5, Administrative Communications.
This is an opportunity for department heads or any member of the public to address the commission. Step right up.
Good morning again, Commissioners. Nelson Castile, Emergency Management. You notice the snow is gradually going away. That is a good thing and a bad thing, and when you consider it. We've had a lot of precipitation, a lot of saturated ground out there, and to tie into last week's Severe Weather Awareness Week, we have our first flood watch that is directly to our west and our north. Many of those rivers and waterways terminate here in Shawnee County or come through, so we just ask people to be watching for any of those floods or any flooded roads, and turn around, don't drown.
Thank you, Nelson.
Good morning, Jim Krause, Shawnee County Councilor again. I just wanted to announce that the County Councilor's Office has completed an update of the county code. It's online now. Big credit goes to Megan Barrett. She does a lot of work on that. Updating the code is sort of more of an art than a science. So if your department works with a particular resolution and you think it needs to be an update, or there's been a later resolution and you don't see it in the code, give us a call. Also, updating sort of spurs us to take a look at what's in the code and see if there are things that need to be changed. I think it was adopted initially in 2006. So we're going to do a couple of things moving forward. We're going to take a look at the format. It's currently simply in a PDF format, searchable through the web, and we're going to look at maybe a couple of different ways that we can format that document to make it a little more user-friendly, a little more easier to search. And we're going to look at also a comprehensive overhaul of that. That's our next step in the process, to see if there are some items that probably no longer need to be there to take out, and some other items that we probably would want in there to put those in. And we'll be taking suggestions on that. So if any department, any county employee has something that they think would be useful to be in the code, just give us a call. We'll consider that. Thank you.
Very good. Thank you.
Morning, Commissioners. Major J. Semeka, Shawnee County Sheriff's Office. Beginning next week, the Sheriff's Office is going to extend hours for citizens to do fingerprint processing. We've seen the licensing mandates call for realtors and child care providers and teachers, even CCHs, and we've seen an uptick in those. So we thought that extending hours in the evening till 5:30 and then also offering some Saturdays would help offset those. There is a $10 processing fee for fingerprints now, and we wanted you to know first in case you got some calls from your constituents. And what we'll do is we will issue a media release probably later on today and get the social media going and generated so that it's not a shock to anyone, and generally just get the word out of the changes to help with those folks that can't get here during the daytime. Saturdays, I think, will help alleviate that problem. So if you have any questions on that.
Very good. Thank you, Jim.
Thank you.
Okay, you're welcome.
Good morning, Commissioners. Angela Lewis with Human Resources. I just wanted to remind all the Shawnee County employees that we're working on our 2020 benefits guide, and we want to make it reflective of us. So we're asking you to send your pictures to me in Human Resources so we can include you and your family in our upcoming benefits guide. Thank you.
Good. Thank you, Angela. Is there anyone else? Guess that just leaves us.
Yeah, it does.
Yes, Commissioner Cook.
Well, this weekend is St. Patrick's Day parade, and so I'm just asking Nelson, are we going to have snow or, sunshine? At this point, it's iffy. That's what we've had the last couple of years, and so I know that the downtown is going to be quite festive with the St. Patrick's Day parade, and want everybody to come out.
Very good. I did want to recognize that Judge Wilson has joined us this morning, and it's always an honor when you come to our meetings, Judge. Thank you for coming. On another item, I read in yesterday's paper that Morgan Chilson is going to be leaving our local newspaper. She was the business reporter, and there's so much going on in our community. JADO, Visit Topeka, Go Topeka, the Greater Topeka Partnership, Momentum 2022. I don't know how we get along without having a business reporter focused on those items, but I think, in my view, it's another indication that our hometown paper is continuing to deteriorate, and it's very sad. There's no meeting on Thursday. Our next meeting will be next Monday, and thank you all for coming. It's good to see you all. Next item, please.
Item 6, executive session.
There is not a need for an executive session, so we're adjourned.